Hello dear students, welcome to the video lecture series for the syllabus designed by Swami Ramanand with Marathwada University Nanded for 4th year B Pharmacy 8th semester belonging to subject Clinical Pharmacy and Drug Interaction. The subject code is BPH87. The topic deals with general methods for the treatment of poisoning, and the topic is going to be covered with different subheadings like introduction, signs and symptoms, diagnosis, testing, and different methods of treatment of poisoning. Particularly the couple of slides that deals with the definition and the introductory details associated with poisoning. Let's understand what the particular poison is in terms of its definition is concerned. So the definition for poisoning is a substance that is capable of causing the illness or death of a living organism when introduced or absorbed. Especially the poisoning is the action of administering poison to a person or animal. But actually this doesn't happen because poisons are not generally administered, but by mistaken these are ingested. So more specifically, the action of ingesting poison by a person or animal, that is to be treated or that is to be called as poisoning. Let's have some of the introductory highlights. Poisoning is contact with a substance that results in toxicity. Symptoms vary, but certain common syndromes may suggest particular classes of poisons. Diagnosis is primarily clinical, but for some poisoning, blood and urine tests can help. Treatment is supportive for most poisonings. Specific antidotes are necessary for a few. Prevention includes labeling drug containers clearly and keeping poisons out of the reach of children. Most poisonings are dose related. Dose is determined by concentration over time. Toxicity may result from exposure to excess amount of normally non-toxic substances. Some poisonings result from exposure to substances that are poisonous at all doses. Poisoning is distinguished from hypersensitivity and idiosyncratic reactions, which are unpredictable and not dose related, and from intolerance, which is a toxic reaction to a usually non-toxic dose of a substance. Poisoning is commonly due to ingestion, but can result from injection, inhalation, or exposure of body surfaces, for example, skin, eye, mucous membranes. Many commonly ingested non-food substances are generally non-toxic. However, almost any substance can be toxic if ingested in excessive amounts. Accidental poisoning is common among young children who are curious and ingest items indiscriminately despite noxious tastes and odors. Usually only a single substance is involved. Poisoning is also common among older children, adolescents, and adults attempting suicide. Multiple drugs, including alcohol, acetaminophen, and other OTC drugs, may be involved. Accidental poisoning may occur in the elderly because of confusion, poor eyesight, mental impairment, or multiple prescriptions of the same drug by different physicians. Occasionally, people are poisoned by someone who intends to kill or disable them. Example, to rape or rob them. Drugs used to disable, for example, scopolamine, benzodiazepines, gamma hydroxybutyrate, tend to have sedative or amnestic properties or both. Rarely, parents who may have some medical knowledge poison their children because of unclear psychiatric reasons or a desire to cause illness and thus gain medical attention. After exposure or ingestion and absorption, most poisons are metabolized, pass through the GI tract, or are excreted. Occasionally, tablets, for example, aspirin, iron, enteric-coated drugs, from large concretions, benzoates in the GI tract, where they tend to remain, continuing to be absorbed and causing toxicity.